So I'm Namir, one of the STP training program directors. There's four of us in the National School of Healthcare Science. And today I'll be talking to you about healthcare science. Just my next slide, just tell you about healthcare science and what healthcare scientists do, and the National School of Healthcare Science and the STP. So the Scientist Training Program. This will all help you if you want to apply for the STP, to give you just a bit of background on what we do in the NHS and why we have this Scientist Training Program. And hopefully we'll have some questions at the end. I'm happy to answer as much as I can, and to make things easy for you if you're thinking of applying for the STP. Okay, so the first point of call really of her slide to show you is about healthcare scientists. Scientists represent 5% of NHS workforce. That's not a massive number, but kind of a small number of the workforce in the NHS, so staff in the NHS. But we work in a lot of different areas. We have over 50 specialisms, so we're involved in a lot of different areas. Although we're small, but we're almost involved in 90% of diagnosis of patient journey, but also 80% of all clinical decisions. So someone's getting a diagnosis, then they must very likely, again, 90% that you'll have a scientist involved in that journey. So from going to the GP to being in a hospital, for treatment, so treatment monitoring, or kind of getting to the decision where the diagnosis has been made. So the three areas that we're involved is the prevention of diseases, diagnosis of diseases, and the treatment of conditions and diseases for patient journey. We are not very well known. We suffer from an image kind of awareness. A lot of people talk about nurses and doctors, but don't talk about scientists and pharmacists. But there's a lot of scientists, there's a lot of pharmacists as well in the NHS. But however, in the last pandemic, COVID-19, scientists played an important role in creating or being part of the creation of the vaccines in the UK. In the testing and the development of the testing strategy for COVID-19. It's all genetic testing, it's all PCR testing. And also the other element that is kind of hidden, which is not related to life sciences and the testing and the viruses, it's when the patients go to ICU, intensive care units, there's a lot of scientists who are under the division of physiologist or physiology, where they look after patients within ICU, for example, and where we had this ventilation challenge. And the ventilation or ventilator challenge is where we had to have lots of ventilators during COVID, patients put on the ventilator, but these machines are looked after by scientists in the physics side and also scientists who are in ICU have a background in physiology. So that kind of put us a bit in the spotlight when COVID happened. So the term healthcare scientist is a kind of broad term that we use, or an umbrella term for many different group of professionals working in the NHS. Mainly have these individuals will have a degree in science, engineering, technology, and so on, to support as I said before, the diagnosis, treatment, and monitoring of conditions of diseases. Within life sciences, just because it's my background, and I don't know if there's a lot of you on this call, but within life sciences, there are two types of healthcare scientists. You have biomedical scientists and clinical scientists, but both sit under this big umbrella of healthcare scientists. They both are protected titles, and obviously those two titles are only used in pathology, another word, life sciences divisions. There are different training pathways and opportunities between, there is variation between the training pathways between biomedical scientists and clinical scientists, but they both kind of lead to the same outcome for the patient. They're just involved in different stages of the patient journey. There's also clinical scientists, as I said before, in physiology. There are people doing studied physiology degrees. and also physics and engineering. So there's a lot of clinical engineers and they're scientists working in the NHS where they look after these machines, but also making sure certain quality is met in all the relevant departments in the NHS. And identity is really important, and it's really important for people to say, "Oh, I'm an audiologist," but really they are a healthcare scientist, but they just say, "I'm an audiologist." So it's important to stick to the bigger title, which is healthcare scientist, to make people aware that these scientists in the NHS. So, for example, if you have hearing issues or challenges when you go and see an audiology department in the NHS, it's all staffed by scientists. I think it's the message here is just basically using one title is to give us a stronger voice. Um, Another important element of having a science, we have something called career framework for scientists. There's different, I'm not expecting you to know this diagram. There's lots of boxes and lots of text here, but just to show you, if you look at the box, the block, so the black box at the bottom, we have different levels of education. So level 2 and 5 is starting the education level. So this is before a degree. Level 6 is a degree. Level 7 is a master's level, and level 8 is a PhD level. So we have different points of entry into the system within the NHS. Just to kind of highlight some roles within healthcare science, and I'm gonna just kind of highlight some life sciences, but I'll talk about others as well. So just in yellow boxes are the life sciences ones. So you have a scientist working in biochemistry, immunology, microbiology, hematology, histopathology. Genomics is a big area now, and there's a lot of kind of explosion in the genomics side where we have cancer genomics, we have constitutional genetics or genomics, but we also have bioinformatics for people with data. We need to look at data because genomics generates a lot of data, and the data needs someone to kind of look into it, filter it, and then give it to the relevant healthcare scientists and or physicians after they filter it. But there's also respiratory scientists, people looking after the lungs, cardiology physiologist looking after the heart, vascular science looking after veins and so on in the blood. Um, Reproductive science is another kind of specialism that there is a lot of interest in it in the recent days. And audiology. Audiology is a very important element because obviously we all need to hear. We all need to have if there's challenges, then we need to have the right compensation treatment for the hearing. So the most important thing for any patient coming to the NHS is having these different people contributing to the journey of the patient. So you'll have the scientist, you'll have the medic, you'll have the pharmacist, you'll have the nurse, you'll have the physiotherapist involved to help the patient to come up with the best outcome for the patient. I really like this picture because I come from a genomics background. And one of the important things I did when I was working in a hospital is to generate reports in genomics to go to the clinician so they can treat the patient uh, or diagnose the patient. But before I issue the report, we used to sit in a room together with clinicians, with nurses who saw the patients. So I come with my results as a clinical scientist with my genetics analysis. They come with their clinical history, and then we sit together and discuss, and that will kind of help me write my reports that goes to the patient file. Just because we have a lot of specialism within science, so 50, roughly just over 50. The way to kind of to make it easy for us to look at them and also within the NHS, we put them into different divisions or themes, if you like. So it's physical sciences, so people with physics or clinical engineering degrees. So you have clinical engineers, you have clinical informatics, you have medical physics. Medical physics have different level of subdivisions, so radiotherapy, physics, radiation safety, imaging, non-ionizing radiation, nuclear medicine. But there's also reconstructive science where when people need part of the body to be reconstructed, again, they have a science degree, and again, there is an STP training program for them. This is all under the physical sciences. The next division is physiological sciences. It's a different part of the human body. So hearing, so audiology, the heart, cardiology, critical care. When they go into critical care, when they have to look at all uh, the systems in the body working in the right way. GI, so gastrointestinal physiology as well. We have scientists there. Neurophysiology, ophthalmic and vision. Again, the vision is important for all of us. Uh, and vascular science, which I mentioned before. I mean, there are others, but probably not listed here because they're quite small. But just to give you the idea that these three divisions. And the third division is life sciences, so pathology, anything to do with the pathology of diseases. So you'll have andrology included here, so reproductive science, clinical biochemistry, bioinformatics, genomics. So this is looking at the genomics data for the genomics analysis, microbiology, embryology, hematology and transfusion. So I started in hematology and transfusion my career a long time ago as a trainee biomedical scientist, and then I moved into genomics, hematology, and then I did clinical scientist in genomics, which covered everything within genomics. Other areas is histopathology, where you're looking at the tissue, the different tissues of the body, and so on. Now I'm going to move to talk about the National School of Healthcare Science, where I work. So it's important just to mention it for you so you understand it. It's a unique organization. Um, I, I don't think there is any organization in any other country that is very similar to this. Obviously, we have the NHS, which is a unique organization in the UK, but we need organization to train scientists. So this is a national school, and the purpose of national school is to train scientists within the NHS. So responsible for training, framework, and the different levels of training within the NHS. And as I said, currently in the school we have about just over 40 specialism within the STP, but in terms of healthcare science there's over 50. There are some specialisms that we don't offer training for because they're very small, but we also offer training in the 4 different countries of the United Kingdom, so Scotland, Wales, Northern Ireland, and England. And we have different levels, as I said, as I showed you before, the different entry points to the healthcare science, so from apprenticeships to level 2 up to consultant grade, which is level 8 training. The other important thing that we are, as a national school, we are an education provider. What does that mean? That means when students complete our training, in particular the scientist training program, when they graduate, they are eligible to apply for the statutory registration. This is important because doctors are registered, nurses are registered, pharmacists are registered, so you can't practice as a doctor unless you're registered. And the same for scientists, you cannot practice as scientist without the registration. So, but because we are an education provider, if you complete our training, you can apply for the registration straight away without any assessment. Going back to that framework that I showed you, just want you to look at the red circle in the middle. This is where the scientist training program sits, so right in the middle at level 7. And level 7 is a master's degree level. And this is kind of, there are entries before it and there are entries after it. And I think the speaker before me mentioned that if you weren't successful in the STP, apply for a band 3 or 4. Just this is before the STP, the kind of on the left-hand side level. So what do we do in the school? One of the important things that we do is we have our own curriculum. So we develop the contents of the program with hospitals and the community and what they need. So we talk to all the, let's say we're looking at genomics. So we work with all genomics departments within within England, and we sorry, within the UK really, and we get them to tell us what they need their scientists to learn and kind of have these elements as part of their training. So we own that curriculum. We develop it with colleagues in the system, but we own it. And we also make sure that universities, so universities that deliver our training program, meet certain standards, but also departments that will host trainees will meet certain standards. So that's why we accredit training centers. And we support trainees and training officers during the journey. I'm just going to jump that slide because this is probably not relevant for today. But the scientist training program is a postgraduate training program. As I said before, it's a level 7, so master's degree. It's a 3-year training program. So it's working full-time plus doing part-time master's degree. And the master's degree is in clinical science. And it's fully commissioned, so the successful candidate will get their tuition fees paid for the master's degree, plus the salary is paid for their role in the NHS. The fourth point here says supernumerary. Supernumerary means anyone who's doing the training is there to train and not to provide the service. So they're extra pair of hands in the department and not to be reliant on to provide a service within this particular department. And the candidates will be employed by the NHS. So it will be one of the NHS trust. We call them providers. And they give you a contract and you will be working with that particular that trust or organization for 3 years. So how do you complete the program? So the program, as I said, it's a 3-year and it has academic element plus work-based assessment. So which I'll talk a bit more about this. So the first thing is you will be doing the master's degree, but to complete the program, you need to have successfully completed all the exams within the master's degree. So first year, second year, third year, because it's a part-time master's degree. We need to complete, or the trainees need to complete something we call work-based assessment. There is a lot of, so you learn the theory at university, but there's a parallel knowledge that you learn within the hospitals or organizations that host the trainees, and they kind of go side by side. So you learn the theory and then you apply the theory into practical, but also learn some practical knowledge and skills, clinical skills that you need to learn at work by doing these assessments at work. But they happen together at the same time. At the end of the 3 years, we have an exam at the end of the 3 years that we do in the school, and everyone needs to pass that exam. So to complete the program, you need to pass all your master's degree exams, you need to complete the work-based assessment, and you need to pass your final year assessment that is done by the school. And by completing those 3, we'll give you a certificate, and that certificate you can take to the Health and Care Professions Council, where you can get your protected title and the registration. But I'm just going to talk a little bit about what's in the workplace. So we know about the universities, there's modules that you need to complete. You need to have assessment and so on, assignments. But at work, there are something we call competencies. We actually removed that title. We call them training activities now. So training activities, for example, it will ask you to observe a procedure in XYZ. So you need to observe that and you show that you observed it. But also there are in-person activities. For example, case-based discussions. So you will basically look at a case and then you come and present it to your assessor. And there's a discussion, so case-based discussion. There's other things like where it requires observation, so direct observation of practical skill. So you'll be doing a particular procedure, whether it's a laboratory or whether it's patient-facing, whether you're sitting with a patient, and someone will be observing you and giving you that feedback. And there are other elements of or other type of assessment like communication, how you communicate to colleagues. But this is all recorded on the online system, and that online system needs to be complete by the training program. So as I said before, you'd be directly employed by organizations. Most of them are NHS organizations, some of them are not. For example, in reproductive science, there's a lot of organizations who are not NHS trust, but they deliver NHS patients, so they also train scientists in as part of this program. As I mentioned, there's workplace assessment and academic training, and they're both combined together, and you need to complete each one of them separately. The salary, you'll be paid full salary and university tuition fees. So the salary is a good salary. It's at a band 6. So if you can, the table on the right-hand side, just in the middle, And the starting point of that salary is 38,000, which is really good for someone just graduating. Kind of just as an encouragement for applicants to be part of the NHS. There's also if people applying for jobs in London, for example, there is a kind of a expensive area, so there's extra money given to trainees like any other band six employed in the NHS. But also, it's I was hearing just before I start talking, it's very highly competitive. We know that, and for that reason, we have to apply some filters. Um, we have approximately about 500 places per year for all the specialism, and applicant number we get about 3,000, sometimes much more than that. But what we're looking for, what am I looking for when I look for a new trainee coming to join the program? But even when I was a training officer before, what do I look for in these applicants? So curiosity. I want to see that curiosity mind, asking questions, scientific thinking, logical thinking as well. So it's not only about knowing the answer, but having a logical thinking, because everything we do in the NHS is about patients. So we need to have that logical thinking, but also understand the NHS values. And the NHS values, you can look at them online. There are pillars of the NHS, and just to familiarize yourself with them before you apply. I want someone who understands what's the healthcare science workforce and what do they mean for the NHS, which I just explained to you at the beginning of the presentation, why I talked about the different specialisms and where we sit and do in the NHS. But also I want someone to understand the program, that it's a 3-year training program. There is academic side, there is work-based element side, and there's an exam at the end, and so on. And also I want you to understand this is all about patient. It's not about you doing research. This is about you learning how to affect and help patient journey, to prevent, to diagnose, to monitor, and so on. I would also speak to someone in the specialism that I'm interested in. I'll speak to a trainee, or I'll speak to someone within that department where they can give me a bit of background about what does a clinical scientist in, I don't know, medical physics or genomics or um, cardiology will be doing. So I think it's important for you to understand that what I put in here is based on last 2 years. When the application window starts, it usually starts in January time. Um, every year there's a lot of factors that we have to consider, a lot of different departments that have to be on board, and basically everything needs to be aligned in the same way so we can start the application process. But usually we start with a webinar. Sometimes we don't do a webinar due to time, but I would just keep an eye on the school website or social media in January. Application will open early to mid-January. So the first element is, sorry, this first point was the webinar. We do a webinar to tell you that we're going to open it in this date. The second circle is the application opens usually early to mid-January. Sometimes that has been pushed to the end of January, and I think at some point we did it early February just because of different kind of organizational changes. Mid to late January, the application will close. I guess that's important date. That's why there's a yellow star next to it. And then you will be asked, so if you applied on time, you'll be asked to do a situational judgment test. And that will open again late January. You'll have 2 weeks, I think, to complete the situational judgment test, and you have to complete it. And then that will close after 2 weeks, so it'll be early February. Again, that's an important time that you need to remember. By doing that, so we'll have your application plus your situational judgment test score. Then the long listing outcome starts. So people get a score and they go into an order, and that's when the outcome is released. You've been shortlisted to an interview, or you've not been shortlisted. So the next bit is shortlisting outcome released. I would say mid-April, because there's a gap here because people need to do shortlisting. It's a lot of shortlisting. But the important thing here is the professions will do that deciding. They will do that judgment and decision by looking at the application. So it's not me. I help sometimes, but it's not my main job. I only help when there is a need, but it's the profession. So a clinical scientist in the relevant area, they will be doing the shortlisting. And then if you've been shortlisted, you'll be asked to create a list of locations. So you will put my first priority, my first location is London, second one is Manchester, third is Newcastle. And then if I score the highest, then I'll get the first choice. If I scored the second, then I'll get the second choice, and so on. And then you'll be asked to come for an interview, and that interview will be the decider. So you passed all the scored high, you been shortlisted, and then you will be asked to do that interview. The interview is done by colleagues within the NHS as well, within the department that will host trainees. And again, that's an important date for you to remember. So I put this just because we're using a system called Oriole, which is used for all NHS recruitment. So this is the score of, just look at the boxes on the left-hand side, so application, and then you'll have a score application for the SJT, and then shortlisting rank, and then interview rank, and then offer. So in that order. Why should you apply for the STP? Well, it's a very well-established training program. It's a very well-structured training program. It will give you lots of opportunity to network. So you'll be going to university and you will be meeting other trainees, other training officers, other colleagues within that field. So you can network. It leads to the registration that I talked about, the protected title, which is a clinical scientist. And this is really, really important in any job that we do in the NHS. Every department, when they put an expression of interest or any trust who wants to train scientist training program, there's very high likelihood that they will keep you in the department, but sometimes it doesn't work that way, but other departments will, so that will be other jobs coming up within the UK. But so the point here, the training doesn't guarantee a job at the end of it, but I would say 80% of jobs they will get a job. In fact, even more than that. So again, just to reiterate the benefit of STP and becoming a clinical scientist. So you'll have this protected title, statutory registered as a clinical scientist. You'll be supernumerary. You will there to train and not to provide service. So you have protected time for training. There's protected funding as well for the training. So you get the salary, you get the tuition fees, but also some funding for you to go to the university and come back. So travel and travel expenses. It is give you access to postgraduate research funding, and this is a part of the training. So you'll be doing a project as you're part of master's degree, and sometimes you have that ability to apply for extra funding for your research. There is a clear path in terms of the pathway of the framework that I showed you before, the different levels. So after the STP, there's another training program that can lead to a consultant clinical scientist. We always, so kind of, I encourage everyone to think of the consultant clinical scientist or understand that there is a more training after they become a clinical scientist, but experience is required. So because you can't be a consultant unless you have enough experience to be able to provide that support and level at a high level of support and supervisory roles or leading a department. So so by having the registration and working in the NHS, you gain the experience to it can be used for a PhD or for the higher specialist scientist training. And also, as a NHS employee, there's a lot of NHS employee benefits. I don't need to talk about them, but you can Google them and see what they are. But you also develop a scientific, clinical communication, critical thinking, research skills. This is important because that's what you'll be trained on. There's also opportunities to develop a clinical academic career. So you'll be working, so a lot of clinical scientists who would be working, delivering lectures at certain universities, but they work in combination with, so the trust have a relationship with a university and you work together. Again, that could develop further into more research. It can open doors for you. Um, and so on. So when I was a clinical scientist in genomics, I worked with a university and within my region. We did some research together, and that did some really important kind of output for the patient at the end of it. Entry requirement for the STP program, you need to have a first or 2-1 in an honors degree in a relevant subject, and there's a list of relevant subjects on the school website. So for life sciences, there is a list of them. For physiological, there's a list of them. But also for some specific program, they might ask for some experience, and it's all listed on the school website. If you have a 2-2, it can be accepted if you have a master's degree on top of that or a PhD. Uh, there is also a need to kind of expect some travel requirement as part of the training role. Especially in certain trusts where they can't provide everything on the curriculum, so they might arrange for you to go somewhere else. Again, this is part of the advert that we put on the school website, but also could be discussed in the interview. Different roles, um, so as in different specialism might require specific skills. For example, I think some reconstructive science, for example, they're a very unique or specialist area. They expect certain level of experience and certain level of kind of knowledge before they accept trainees, but it's all listed on the school website. Um, I would advise you to look at the job description, again, it's on the school website, and when you apply, answer the question that you're answering. Um, and you know, it's important that I've read applications before and people start talking about their research and their experience, but they're not answering the question. It's be specific, answer the question. I know it's limited number of texts, but answer the question, but also you can give examples within the limited space. It is open to international recruitment, absolutely. Obviously, they need to have the right to work in the UK. Um, and there is information again on the school website for that. This is just to say that there is a lot of information on the school website, and if you go under applicants, there's a lot of kind of specific areas that you can look at. The list of university that delivers the program, the different specialisms, the list of degrees, and so on. But also, I would encourage you to go and find out more. I mean, obviously, you're here listening to this, but also you're talking to STP trainees, which I think you did today. You had 2 presentations or one. There also on social media, there is something called STP Perspective that is kind of a group of trainees who created this social media account where they can give you a bit of advice. There's also the student room. I think someone mentioned it before me. There are other social media area, but I would definitely do your research before you apply, so you'll be kind of prepared for the application and what is expected of you beforehand. What makes us a successful candidate? I mean, I would really do my research. If I'm interested in physics, then I would go and look on the professional body website. Um, but for that particular area, there's something called IPEM, which is Institute of Physics and Engineering and Medicine. Look at their website, they give information. If you're interested in life sciences, then again, look at that professional body. Um, Speak to trainees, speak to departments and understand what they do. There's also open days that some trusts will do this month, also last month, there's a couple, and some do in January as well. There's also podcast open days. Um, and kind of some of the examples that I put here is the NHS kind of 10-year plan that's just released recently. I'm not expecting you to go and read it, but it's just to give you a vision of where the NHS vision go into the future, just for you to be aware and not to go and study. There is the genomics kind of future plan for the NHS, and the constitution of the NHS. It's really important that you are aware of it. This is just my colleagues that we all look after the STP in the school, and I'm happy to have any questions from anyone.